There we go. Hi.
Yay! Can you tell this is my first time doing a TikTok live? I know it's not yours.
Literally brilliant, but when you're inviting and uninviting, the problem was I wasn't live. So we're good now. We're good
Okay,
now.
great. I'm so glad you're here. And for
Sorry, he wants to join. He always does this every time I go live.
oh
So
my, what's his name?
Rex, say
Rex.
hi. Okay, buddy.
Oh, he's so affectionate. I've got a Rocky who might join, but he's probably not
Oh,
as
how
cool.
you
He's good.
doing, Mom? So hi. So
Hi, I'm so glad to meet you. I
yeah,
have read
so
the entire book, The Gal.
just joining. Oh, yay.
Yeah.
So my name's Dr. Mary Claire Haver. I am a board certified OB-GYN. And I have chosen out of my own desire to focus my practice on the care of the menopausal woman. I've had kind of a 6-year journey getting certified in nutrition and medical nutrition and creating the Galveston diet and then opening up a clinic. And so a question that I get a lot from followers, like I actually have people who fly in to see me, which is so flattering to me, but is ridiculous that they can't find good, reasonable menopause care where they are. So why don't you talk a little bit about what my alloy is? Because my followers are desperate
Oh,
and
yeah.
they need good care. They cannot find it from their local docs.
And I want to talk to you about or ask you about why you think that is and what we're going to do to fix it. But certainly, so I started it's called Alloy Women's Health, and our handle everywhere is My Alloy. And I started with a friend, Monica Molnar, who went into surgical menopause at 40 and she took basically 5 years and 5 doctors or more to figure out how to actually take care of herself. And it was a really grueling journey for her. And it reminded me of other parts of my own medical history. In fact, I didn't even know until we started the company that I was in perimenopause because I didn't even know that perimenopause was a thing. No one
Yeah.
had. So, and my own symptoms were like terrible mood swings, weight gain, sleeplessness, like all these things that I never would have put together because I didn't have hot flashes or like any of the classic symptoms. So anyway, we started talking about doing this and we put together an online telehealth company where you can come in and give your medical history, and a board certified OBGYN menopause trained doctor will review your symptoms and give you recommendations. And then if you choose to purchase, we waive the doctor fee, but you purchase your solutions and we send them to you at home, straight to your home. And we do that every 3 months and you can cancel at any time. But we have been um, sort of open for business for almost a little over a year. And it's been unbelievable to hear these women's stories. We do support groups about twice a month, and listening to woman after woman after woman talk about how, their doctor ignored them or gave them the wrong advice, or they couldn't find a doctor to even see because there was an 8 month waiting list. And this is just for like a regular old doctor.
Right.
Why do you think we're in this state? Why is no one helping women at this stage of
Uh,
their life?
Actually, my next book is about this exact, it's like the state of menopause, basically, not to steal from Stacey London's, company, but where we are, how do we get here? How do we get to where a third of women in the world are in a perimenopause, menopause, postmenopause journey, and we have only 10% of research dollars, well, not, it's even less than that, because if you go to PubMed,
Mm-hmm.
and PubMed is a medical database where, medical professionals look up the latest peer-reviewed research journal articles. So if I'm looking up menopause and shoulder pain, frozen shoulder, that's where I'm going to go to see who's done the research, whatever. And I just type in the word pregnancy. 1,100,000 articles come up from the beginning of time since they started recording these. And
Wow.
then that's a lot. Pregnancy is important. We need safe pregnancy. We need research on pregnancy. I'm not knocking it. So now I type in the word menopause. 94,000 articles.
You're kidding me.
No,
That is
94,000. So think of why that happens. And this is how we are where we are today. Menopause is not prioritized. It gets the bottom of the barrel for research. It gets the bottom of the barrel for treatment. We had this absolute, and I'm quoting Peter Attia. He's an
love, love
professional.
him.
The Women's Health Initiative was probably the single greatest F up, in his own words, in the history of medicine. It has done more damage to human beings than any other medical study in the world. And I even thalidomide.
Healthy talking about, right? That's across the board. Everyone.
So in my own training, now, I spent 4 years doing obstetrics and gynecology in a traditional OB-GYN residency. And then I spent about 12 years as a program director.
Hmm.
Okay. As the person in charge of the education of residents to become OB-GYN. So I can speak very clearly on what it was. We learn important stuff. More than 50% of our training is in obstetrics. Obstetrics is important. So then the say the next 45% gets divided up between pediatrics, oncology, OBGYN cancers, pediatrics with OB-GYN, fertility issues, reproductive endocrinology, like endocrine things that go wrong in us, Turner syndrome and all that. And menopause is like a tiny, tiny, tiny sliver and piece of the pie. So there was a study that Mayo Clinic did, and and you've probably seen it, where they asked OB-GYN residents coming out, how many of you feel competent to take care of menopausal patients? And it was 1 in 4. Like 75% of OB/GYN residents coming out into training said, I don't know what I'm doing. I have no idea. Okay. And then it was like only 1 in 10, like people actually in practice felt competent, because you lose what you learn if you don't take care of it. When you get out of practice, they immediately throw you into a job where you're just out there to deliver babies, and a few emergencies here and there and do surgery. And so insurance companies don't like to pay for menopause. They don't want to pay for the time it takes. We had no training in perimenopause, none. We didn't know how to recognize it. And there's not been a single study on the treatment of the perimenopausal woman, not one. Now, what they've done is looked at women who happen to be given birth control pills in perimenopause for whatever reason, and how they fared through their perimenopause journey. And they've actually done remarkably well. They have less depression, less visceral fat, less weight gain, all of it. Sorry, I know I'm going off. This
Oh,
is my
you're preaching fire, but I'm so glad. Like, no one knows this. I think we talk about it all day, every day, because I speak to menopause specialists and people in the menopause world. But then I talk to my friends who are my age. I'm about to be 51. None of them know any of this, and these are, educated women with good doctors, and they're just being left to sort of wither in the wind. It's unbelievable. But why do you think? So why isn't anyone teaching this in medical school?
So medical school, it's like the menopause is the end of your reproductive cycles. They don't go over the health risks. Now the American Heart Association is coming out with the cardiovascular risks associated simply with menopause. Now the neurologists are coming out with the risks of, early menopause and untreated menopause and the increasing risk of Alzheimer's and dementia. Now these other societies are coming together and doing a look back and saying, wait a minute. I mean, this is an independent risk factor. So say I took identical twins, right?
Mm-hmm.
One had surgical oophorectomy, like she had tumors or something and had to have her ovaries removed at 40. And the other one went through a natural menopause, or say she was 45. And the other one went through her natural menopause at 55. The 45-year-old who lost her, who was castrated, who
Mm-hmm.
was menopausal, has a much higher risk of cardiovascular disease, much higher risk of overall cancer, much lower quality of life, more genital urinary symptoms. It's just on and on and on. So we've demonized through the WHI the treatment of menopause. No, it's been shrouded in shame. This is a societal thing. Women aren't worth much once they're done childbearing. What's going on in this crazy patriarchal society. We're taking away women's rights. Just wait. If they're taking away, hormones are on the table to be taken away. So get
They
ready.
are. God, they just
Well, they're
just put
trying to
paper back on
restrict,
the table.
they're trying to restrict access to certain birth control options, which are hormonal,
Yep.
which will just, the pharmacist will get scared. This is the same medicine that's in the birth control pill. I don't want to go to jail for prescribing something that's illegal.
Oh my God. So many questions. First of all, I saw your post about birth control pills and perimenopause, and I was cheering because I actually wasn't on the birth control pill for 10 years or so. I had my kids, et cetera, and then was put back on it once I figured out I was in perimenopause. And I actually have found it to be so helpful. I mean, my mood swings and so much has improved, but I know for some reason it seems like it's controversial or people are. Um,
I think you're just on the wrong side of TikTok. There's a very certain subset of people with very little clinical evidence to support their claims who are just demonizing hormonal contraception. And I have to say, it's got to be the right leaning, I don't care what side of the fence you're on, but like when
mm-hmm,
you're taking away a woman's ability to control when and how she gets pregnant,
mm-hmm.
it's just not good. and this is medicine that can actually be helpful to her symptoms, and it's just in that form. We're not doing it for contraception. And if she needs it, fine, but
Mhm.
we're doing it to alleviate her symptoms.
Yeah. And that's certainly what it's done for me. Um, so can you just explain? I love it. Everything you've said is just like music to my ears, and I love hearing it. But can you explain calling a oophorectomy a castration? Or you're just saying like you've castrated her?
Yeah. So, I mean, I'm calling it what it is. That's a medical term. But, when I say castrate, everyone thinks you cut the testicles off of a man, right? The exact same procedure when you remove a woman's ovaries, whether it's needed in some cases, if she's precancerous or, horrible endometriosis and absolutely nothing is working, surgical castration is a medical treatment for conditions. It's rare, thank God. But, surgical menopause is much higher risk, much higher symptoms. You don't get that, even though our easing into it ain't that easy in perimenopause. You still have some estrogen on board.
Hmm.
When you go cold turkey, it's 10 times, everything hits you like a truck. You don't have a weaning in period. It's much worse. And the health risks are worse.
Has there ever been a medical reason for a man to have his testicles cut
Cancer,
off?
yeah. Yeah.
Cancer.
Testicular cancer. Yeah.
And what about, is she at high risk if she if she goes in surgical menopause and goes immediately onto HRT?
So you dramatically ameliorate. You could nothing. What I tell my patients, nothing ever is going to work better than your 25-year-old ovaries. Okay, hormone therapy is going to go a long way, but it's like a hip replacement. Like
Right, right,
you're not going to have your 25-year-old athletic body back, but we can make you functional. We
right.
definitely function. And so that's kind of how I approach. We can definitely ameliorate many of the health risks of losing your ovaries or going through menopause with hormone therapy. So if you've not done this yet, so everybody listening, take 1 second, take your finger and tap our heads like 10 times. That is going to give us likes. TikTok asks that we do this from time to time. It draws likes. It makes the algorithm work. And also, if you think this video would be helpful to someone, there is a share button at the bottom, kind of right. It's got a little right-sided arrow at the bottom. You can share this video with someone that you think. And then if you're interested in My Alloy and what they have, you absolutely can follow them. Just click on their link and become a follower of them or me if you're new to me watching this video.
So I got to ask you about TikTok, but first I want to ask you about how. Thank you for showing me the ropes. But how did you how did you decide you want to devote your life to serving menopausal women?
It was a process. So, the whole like Galveston diet journey started with, selfish, completely selfish. I was struggling with my own menopause and struggling with some very unexpected weight gain. The weight gain accelerated because I was grieving the death of my brother in,
Got it.
2015.
Mm.
And he died in December. So it was like 2016. I was just kind of a basket case. And then, probably July, August, said, okay, the grief was lifting and I was trying to get back to myself and realize I had this new belly that I never really had before. So I was like, all right, let's do what I tell my patients, work out more, eat less, work out more, eat less. And it didn't work. And so I was like, wait a minute, this has to work. So I was doubling down at the gym. I mean, like I've told patients this for years, like the law of thermodynamics, this has to work. And
Mm-hmm.
I was calorically restricting to dangerous levels. I was doing 2 a days at the gym. I mean, I knew I was just absolutely obsessed. I was getting up in the night to pee because, menopause. And I would then weigh myself. Like it was absolutely pathologic, out of control. And so my husband was going on a long work trip. And I said, when you get back, I'm going to be back. You're going to have the wife you deserve. I'm going to be back to myself. And he was like, hey, you're modeling this behavior for your children. I mean, and that stopped me in my tracks, and he said, this is not healthy. You're
Mm.
beautiful. I love you. I don't care what this is or whatever. It doesn't, but I love you and I'll take you whatever, I'm not that picky.
And
And,
we love them.
he said, but you can't keep doing the same thing and expect a different result. He said, you're a scientist, honey. You're a smart girl. Figure this out. And so I took that as like the ultimate challenge. So I called up the PhD nutritionist at the university I was employed at. And I was like, what the hell is going on in menopause? And so, well, aging is more related to the scale number going up. But what we see in menopause is this visceral fat deposition. Like you're starting to put on fat in your midsection, and that fat is dangerous and linked to hypertension, chronic disease. And I go, well, how do we get rid of it? And they're There's no medicine really that this is before the GLP-1 agonist. So there's no medicine, but nutrition can go a long way. So they gave me all these articles. I went down rabbit hole after rabbit hole, and I was making all these inferences between menopause and inflammation and nutrition and inflammation and aging and how it all fits together. And then, these recurring themes in the literature were coming up around how do you lower chronic inflammation? Intermittent fasting can go a long way. Not great for weight loss, but
Mm.
good for lowering inflammation.
Hmm.
Looking at anti-inflammatory nutrition holistically, like from a nutrition standpoint. So I found a program at Tulane called Culinary Medicine. It's a medical nutrition plan. Enrolled there, took 18 months and just dove in, had to sit for an exam, certification, the whole thing. And then that really became the cornerstone of this guy. And I learned all about micronutrients, what we're deficient in general in menopause, and da 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 da. Put it all together in a little program for me. Gave
Hmm.
it to my patients, Xeroxed it down the street, handed it out. It's a little town here, and
Hmm.
uh, the patients were loving it. My menopausal patients were like, "Oh my god, this is like a miracle." So then my girlfriends were doing it. Then I took it to social media, Facebook at the time, and said, "Hey, anybody want to try my program?" And yes, like by the thousands. So I gave it away for a year and a half and
Wow.
experimented, and they gave me feedback. So I kind of took all those learnings, and then it was like growing by the thousands on social media. And so I had some savvy entrepreneur friends who were like, you should trademark this. This is
Mhm.
becoming getting a life of its own. And I was like, I have a job. I'm fine. And, but I thought, let me try it. So I tried an ebook years
Mhm.
ago. Disaster. No, that didn't work. And then I tried an online course. And so I went through Teachable, and I said, I threw all the stuff I'd compiled, put it all in videos and just all the recommendations that people had helped me with, and made an online course and threw it out into the universe, and it blew up. And so within 2 years, it was a 7-figure business. I was hiring coaches. I didn't know what, I left my traditional job and I said, let me go and be a hospitalist so I can go part time.
Hmm.
And so, not thinking I was going to go in the menopause space, but the more I talked about nutrition and menopause on social media, the more people wanted to talk about menopause.
Mhm. Mhm. There's
Like,
such a hunger out there. I
like
feel like,
every, like the sponges, like thousands of questions. So it just kept getting broader and broader and broader. And I was reading more and more and more. And I was like, wait a minute, we're doing this wrong, you know?
even then you thought that.
And then COVID hit, and nobody wanted to be on a diet.
Mhm.
So I had to double down at the hospital. Everything went crazy. So
Mm. Mm.
while I had downtime at the hospital, I was thinking about what's my next step? What do I want to do? I really think I want to focus my next big thing on taking care of menopausal women as a practitioner. What's out there, and I found
Mhm.
some really good stuff out there. There are some practitioners that are turning menopausal women into cash cows
Yep.
and running
100%.
them through like these hormone mills and over prescribing and over treating and not there's no nuance, and
Mhm.
there's some non-evidence based stuff out there, and I was like, I don't want to go that route.
Yep.
And so once kind of things died down from COVID and I felt like I could leave the hospital not in a lurch, I said, I want to do this clinic. So I've never opened a clinic in my life.
Oh, so this
I've
is
always been employed. And so I
yeah.
had to build it from scratch. And we opened in October of 2021.
Oh my
And
God, congratulations. That's when we started Alloy, November
yeah,
20.
so I have a 100-person waiting list.
Oh
So
gosh. And is
yeah,
it just you?
it's just me. Yeah.
Wow. And people are flying in to see you.
Yeah. So I don't have hospital privileges. I don't do exams. I'll
Mhm.
look at something real quick, but
Mhm.
you're coming to talk to me, you're telling me your menopause story, and I not only do hormone therapy, but I give you a whole nutrition plan. We talk about exercise, stress reduction, sleep. I have a body scanner where I can measure visceral fat, I can measure muscle mass, talk about sarcopenia, and just really give them a plan that they can stick to for the next 20 years so that they're not frail or
Yep.
obese, or just like they're looking at what their parents are going through and their aunts and uncles, and,
Mhm.
and how do
Yep.
I so
Yeah.
really people turn their lives around.
So I can't believe I've sort of thought you've been out there forever, but this is all like you've kind of been doing this in some ways as long for as little as time as we have. But
Yeah.
you before that were doing the Galveston diet, which I was already aware of, and so aspiring to do it. I gotta say, I gotta figure out what to do about the morning because coffee, black coffee, I just can't quite get there. Can I
So
put?
make that your first goal. Like, don't worry about fasting or anything. Just give yourself 2 weeks to slowly decrease the additive, whatever you're doing to make your coffee wonderful. and
Okay.
just slow. That's what I did. I just slowly was decreasing the amount of cream I was putting in and the equal.
Okay.
And and then you have to kind of knuckle it down for about a week and then it becomes magic. Now, my trick is put in the grinds, not in the coffee cup, in
Hmm.
your a little pinch of salt and some cinnamon, like ground cinnamon.
Ooh.
And it will take the bitterness out and make sure you're using decent quality coffee.
Right.
And then try it. And once you're used to it, like the followers out there who are black coffee, I'm telling you, I swore I would never do it.
Yeah.
Now I cannot imagine putting anything in my coffee anymore.
And so what about, I was talking to Monica, my co-founder earlier today, and I was like, she was like, oh, you're doing the Galveston diet. I love her. We've been
Uh,
obsessed since we first started and we have so many questions for you. And I was like, I know, I really want to do her diet. I listened to your book when I was driving through North Carolina this past weekend. And I was like, I just have to get past the coffee. And she said, well, if she's so into fat, maybe you could put butter in your coffee. Do you remember that trend?
yeah, I was on that guy's podcast. Uh, he's a nice guy, just a little different.
Mhm.
And so I'm a fasting purist. So studies I read, the ones on neuroinflammation and Alzheimer's and dementia, reduction or
Mhm.
during a fast.
No,
So the
what? Sorry, I missed. I just kind
theory
of,
that I just do black coffee and I have very little calories, certainly
uh,
not butter
uh,
until
okay. All right. Next question for me about the diet. Then I want to get back to the larger picture, but the percentage of fat versus carbs versus
yeah.
protein. So
So we
it's
kind of have, that's like a plus or minus. You don't have to be perfect. The meal plans are not exact. You'll have 23 on this or 42 on whatever one day. It's if you're trying to lose weight, if you're trying to lose fat,
mhm,
going lower carb, higher fat. One, it helps you break the sugar addiction. It's kind of
mhm,
training your body to not be so dependent on that quick fix of a simple
mhm.
carb. And then once you start getting to your goal weight, we add in more legumes, more fruit, more, and cut back on the fat a little bit. But you got to make sure you're getting enough protein.
Okay. Yep. So I, like 100 years ago, did Weight Watchers, right? And I remember that fruits and vegetables were free or like
Yeah,
zero, right?
my the CEO is a friend of mine.
Oh,
Well, mutual. We talk offline. So
great. Well, you both have really both had a big impact on my life. But the fruits and vegetables were 0 points. So my whole life, I've been like, even if I'm not on a diet, I'm like, I can eat as many fruits and vegetables as I want. I love them. Like, I'm not one of those people who it's like, oh, you want to lose weight? Well, you should cut out the ice cream. Like I'm not eating ice cream. I'm eating a lot of really healthy food because I love it. I'll do like giant portions of Brussels sprouts and stuff.
so
But
when
I think,
you add in, I mean, no, and here's what my nutrition professor taught me. Nobody gets fat eating fruits and vegetables.
okay.
You know, and it's when you add in more fat you learn to become satisfied and it's healthy fats. We're not talking about butter and bacon and I mean a little bit of that. I mean, I like butter, I like bacon, but it's more like the nuts and the avocado and the seeds and the things that are just packed with not only healthy fats but omegas and fiber and vitamins and minerals and nutrients. And so it's just kind of reshifting everything that way so that you're full and satisfied, and so the cravings cut down because you're not your blood sugar stays more stable.
Yeah, you're the first person who's ever told me that I can eat a whole avocado in a day. I mean, I've always been cut
Avocado a day,
short.
bro. My staff teases me at the clinic. They're like, an avocado a day keeps the visceral fat away. And they're all walking around eating their
I'm
avocado.
so excited. I could do that for sure. And eggs, I could do avocado and eggs all day.
Yeah.
But it's just a couple, it's really part of it is just like getting up and doing it. Um, but I wanted to ask you, so what's that? I know there is difference, but tell me, how is this different from keto?
So keto, the way most, and I've kind of known about keto for a long time, and I think even after one of my babies, I was a big gainer in pregnancy,
Mm-hmm,
and South Beach, which is kind of keto esque.
mm-hmm,
Our backbone was more Mediterranean for what we were picking. We were going with the whole grains and the legumes and the fish and using those principles for anti-inflammatory nutrition. Keto is like pee on the stick, make sure you're in ketosis, weight loss at any cost, lots of inflammation, lots of constipation. Not some people do, there are different versions of keto out there.
mm-hmm,
So
mm-hmm.
I never wanted, more when you burn fat your body creates ketone bodies, but I don't have anyone check that. Is not a goal in our program, is to be in ketosis.
Okay.
you know you will probably be in ketosis from time to time because that's when you burn fat. That's what your body creates for, fat for
Mm-hmm.
fuel. And so I think a lot of keto is, very, very high in saturated fats, can be very, very, from my nutrition studies, very, very pro-inflammatory, where we're stressing, whole grains, fruits, vegetables, things that naturally fight inflammation when the way a lot of people do keto can be pretty inflammatory.
Mm-hmm. Okay. I mean, it's just really, I guess, about increasing those good fats too. I mean, there's no way to summarize. Like, I love that you have a whole chapter on the different hormones and their roles. I thought that
Mhm.
was brilliant. Um, can you talk a little bit about estrogen, speaking of hormones, and why you love it?
Yeah. So, if we never went into menopause, I don't know how we would die actually. Like I guess we just out eventually. But estrogen, as it turns out, there are estrogen receptors in almost every organ system in our body. Okay. Besides the ones we know about, your breast, the genital urinary system, the uterus, taking care of a baby and all that. There are estrogen receptors in our brain. There are estrogen receptors on our tongue. There are estrogen receptors on every mucous membrane. There's estrogen receptors in our skin and our bones and our joints and and so when we lose that estrogen, begin that decline in perimenopause, everyone's menopausal journey is different. 85% of us will have hot flashes, and that is basically where the similarity ends. And so, where I might have horrific joint pain, migraine headaches, and gastrointestinal disturbances, you could have like crippling anxiety, new mental health disorders, ADHD, frozen shoulder, and absolutely can't sleep to save your life. And
Mm-hmm.
so, part of the problem of missing the diagnosis of menopause is we've never been taught to look at it
Mm-hmm.
constellation of symptoms. We go line by line
Mm-hmm.
to want to fix things. And the beautiful thing about estrogen is it can help almost everything. Whereas if and for those of you who are not candidates for estrogen, and I think a lot more of you are than are being told that you are, because there's a lot of misinformation around that or just under education, that then we treat it symptom by symptom because the band-aid that's going to do the best, the gold standard that's going to treat the most things at once is always going to be estrogen.
And so why, I know you talked about this in your book, but like, why is one thing that happens when you lose your estrogen or your body stops making so much estrogen that visceral fat happens?
Yeah. So lots of emerging theories around that because visceral fat has been known about, but as far as like its metabolic consequences, that's newer.
Mm-hmm.
And that, men kind of gain visceral fat throughout their lives and they think it's driven by androgens. Okay.
Okay.
And so, if they are following a certain, pattern of eating that is going to promote visceral fat deposition, along with aging, insulin resistance, the whole 9 yards. But women tend to not do that. Okay. Till perimenopause and menopause. Their fat deposition tends to be around the hips and thighs. And then all of a sudden, when the estrogen levels start declining, they start driving fat to the abdomen. And so, one of the big theories is that when our estrogen levels decline, our liver makes less steroid hormone binding globulin, SHBG.
Mm-hmm.
That is a protein that binds our sex hormones and renders them basically inactive until you need them. Then they bounce off the protein and go do their job. Okay. So some of you have had like a testosterone level done, there'll be a free and a total. So
Mm-hmm.
total is everything that's floating around your bloodstream, but free is what's actually active. Okay. So if we drop the level of that binding hormone, a binding globulin, sorry, binding protein, then the activity of what's in our blood will increase, even though your levels are the same. So in the perimenopause journey, the activity of our androgens increases, and they feel like that is the one of the defining factors as to what is going to drive fat to the abdomen. They're still studying it. There's some other emerging theories coming, but that's kind of where it is. Another independent risk factor is diabetes with menopause and insulin resistance. And we know that as insulin resistance increases, we drive more fat to the abdomen as well.
So many things plaguing us. So will taking estrogen or HRT, will that help us with?
attenuate visceral fat. So the best, no one's doing studies on estrogen right now. Okay. So what they've done is they do look backs and they say, okay, we have this group of women that are basically similar that were on hormone replacement therapy kind of early in menopause and continued it for 10 years. And then we have this group of women very similar to those and they just weren't offered, didn't want it, whatever, wasn't on HRT, and they followed them. Okay.
Hmm.
And what they found in the HRT group, and when I say HRT, I'm not talking testosterone, I'm talking estrogen plus or minus progesterone, was they had lower visceral fat accumulation there, and they had lower diabetes, and they had lower, well, osteoporosis. We've known that forever.
Yep.
Had,
Lower visceral fat. That's
so they had lower visceral fat deposition. So there's hormone therapy started on the early end seems to attenuate that visceral fat deposition.
okay. Someone's asking in the chat, is timing, et cetera, important when testing estrogen? Do we have to test for estrogen?
So no, not usually. The definition, and a lot of you are going to be told that you need to spend hundreds of dollars on urine or saliva testing.
Hmm.
It's not necessary. A menopause, someone who knows what they're doing, in one conversation can determine if you're menopausal. If you are over the age of 45 and you have not had a period for 1 year, you are a postmenopausal woman. The end. We don't check levels. It is not necessary. Urinary metabolites, which is the Dutch test. Remember, there's one lab in the world that runs a Dutch test, okay? And all of the studies that were done by this one lab. So they had a vested interest. You can't go to Quest to get a Dutch test. Insurance is never,
Exactly.
and there's no study that's shown that the urinary metabolites have anything to do with exactly what's going on in your bloodstream. So save your money. Find someone who does it. I've never done a Dutch test. I would never order a Dutch test unless some miracle happens and they say it's beneficial or it's helpful. But I treat my patients based on their symptoms and I believe them. I don't need a magical expensive test. You're telling me all these symptoms are happening. I believe you. I don't need a blood test to prove that you're a perimenopausal woman. There is no blood test to diagnose perimenopause. It is a diagnosis of talking to your patient and listening to her and believing her. And I might do blood work to make sure it's not hypothyroidism or autoimmune disease or anemia or low iron or something else that can have overlapping symptoms. Rheumatoid arthritis. I've diagnosed lupus this year. Like some of the things sound the same. And so we have to make sure it's not X. And then the only thing left is perimenopause. The end. Treat.
So, because when you're in perimenopause, right, your estrogen levels are kind of going all like this. So if you test,
Right. So perimenopause, the overall trend is down, right? But it is literally a roller coaster. Woo! All the way.
well, I can attest to that. That is definitely what I was experiencing. And so is it hard as a doctor to diagnose perimenopause?
You have to know, first of all, I cannot tell you the number of followers on social media who have come back to me and said, my doctor doesn't believe in perimenopause. Guys, it's not Santa Claus.
Yeah.
It is transition from normal reproductive cycles to your full menopause. It is a thing. That person has chosen not to educate themselves as to what a woman is going through after they are done. And by the way, a hysterectomy is not a menopause cure or a perimenopause cure. Please do not let someone remove your organs or castrate you in an effort to get them out of your office and take all your money.
I love how you referred to, you said something earlier that there are a lot of people out there treating menopausal women as cash cows. I haven't heard it phrased like that, but I definitely know that we see that everywhere too often. And so it's so important to get voices like yours out there and to really get the menopause experts
I mean,
um,
we
on
can get
TV.
safe, efficacious, affordable hormone therapy. It doesn't have to be complicated, you know?
Well, God bless you. And that's what we're selling. And we have menopause trained doctors at Alloy, myalloy.com. We are prescribing the FDA approved generic HRT, as well as having tons of conversations like these. I'm so grateful for you, Dr. Haver. I'm grateful for you, and I'm grateful to you for coming on and talking to me for this long. I know we've been at it for almost 40 minutes. I could talk all night, but
So, well, a lot of people come in and out. And I think a lot of them are my followers and like they don't know these services exist or I get a lot of questions about them. So just talk a little bit more about what you guys do and how they find you if they're interested in, a menopause doctor online.
So we are at myalloy.com, and we are, started by two women who were around 50 years old, experiencing perimenopause and menopause, who were just looking for answers. And we found doctors by listening to podcasts, and by going to the North American Menopause Society conference, and really meeting people like yourself who really know their stuff. And we just decided that there was a real access problem, and we needed to get this information. There's something like 1,100 NAMs certified, so that's certified by the North American Menopause Society, doctor or healthcare practitioners who, and there are people out there who know what they're doing who are not NAM certified, but for the most part, that's where the people who know what they're doing are going. And there's 1,100 of them on their website. And we are 55 million women in the US in menopause, some state of menopause. So we just wanted to fix that access problem. So you go to our website, myalloy.com, you give us we've done a whole sort of medical intake questionnaire designed by doctors. You give us your medical history, and we recommend, usually prescription hormone replacement therapy, sometimes vaginal estrogen cream if you're having vaginal symptoms only. We also prescribe, pill, patch. We also, for like people like me in perimenopause, we prescribe the a low dose birth control pill. These are all protocols that have been approved by, North American Menopause Society, the American College of Obstetricians and Gynecologists. We have doctors reading every single case and deciding and making recommendations for what they would think that you should be taking and recommending. They can chat with you, ask you questions. You can also have an appointment with her for $35 before you get prescribed anything or before you do that. So we really want to get the information and the doctor expertise out there. Then once you decide to become an Alloy member, you purchase your medication. We ship it to you in a cute little pouch to your home every 3 months. We bill and ship every 3 months. You can cancel at any time. And the whole time that you are an Alloy member, you can hop on your phone or your website, and you can like ask any questions. You can text 24/7. The doctor won't get back to you within 5 minutes, but she'll get back to you certainly within 24 hours and usually within the day, answering any of your questions. You can do that at any time. That's a huge service because these are specialists who really know what they're talking about. And then, we just hope everyone feels better. About 88% of our patients feel better within 2 weeks, just because so many women out there are suffering needlessly,
And
thinking they can't take
I'm
hormones.
not sponsored by my alloy. I'm not getting paid to do this. I am simply wanting to get as many people treated who want to be treated, who deserve to be treated. And if you cannot find, I mean, I'm going to say it clearly. I think in person is best, but there's just not enough of us. And I have online therapists. It was impossible for me to drive an hour to Houston to find a good therapist. I have a great person online who takes wonderful care of me, and we have Zoom meetings. And so that kind of like really opened having such a good experience is what opened my eyes to this kind of a service for those of you who cannot find a menopause competent provider in your area. If someone, call ahead, if you're trying to make an appointment to see someone, and they have, even if they have I treat menopause, call ahead and say, are they going to have a conversation with me about hormone replacement therapy? Because they may say I treat menopause on the website, and you go in there and like, I don't believe in hormones. And you've just lost your copay right there. And so, if that's your case and you cannot find anyone, North American Menopause Society has a list of 1,100 on their website. I have a couple of hundred on my website. But then this is a great option for some of you.
We are just so proud to be part of the solution, and there's so many more people talking about this now than were certainly when I started. And when we first launched, we got a lot of patients from the South because we launched in 50 states, all 50 states plus DC. And I said to one of our medical advisors, I said, "Wow, we're really popular in the South." And she said, "I'm from the South, and there are no doctors down there." So some people just have trouble literally finding a doctor within driving distance who can even deliver their baby when they're at that stage, but certainly to find someone when you live far away from a major medical center who really knows what they're talking about is difficult. It shouldn't be this hard.
If your gynecologist said no hormone replacement therapy during perimenopause, even if they're NAM certified, sometimes they have not gotten the whole information. You absolutely can be treated for perimenopause. It's 100% you can be treated. So, I'm reading the questions down below.
Yeah, I know. I'm seeing them too. This has been really fun. I love.
They're asking about oversight. Is there an endocrinologist? Do you talk to other doctors to make sure there's oversight?
At Alloy, we
Yeah.
do. So we have about physicians who are NAM certified, and they look at every single case. And so we also have Sharon Malone as our chief medical advisor, and she's helped us, write the protocols. And she wrote them. We didn't write them. I'm not a doctor. Um, so she's like come up with the program, and we are constantly checking in with all of our medical advisors about what else we can do, what else, we started out, for example, prescribing a vaginal estrogen cream, but there are other people who just prefer a different form, like a pellet or a ring. And so we're looking into other ways, because that's something that has helped so many women, just the vaginal estrogen alone.
And it's so safe. There's no increased risk of breast cancer or zero. Vaginal estrogen is like no increased risk of blood clot or breast cancer. So even if you are a breast cancer survivor or have the gene or have had a blood clot, you are a candidate for vaginal estrogen. It can change your life. So
We've heard from so many women whose lives has changed. I mean, I just couldn't believe all the suffering we heard about, and all the people who are out there just thinking. I mean, we talked to someone who it was too painful for her to walk, and my vaginal estrogen cream feels so much better. So it just seems almost criminal to me that there are really simple and very safe and well studied solutions out there, and so many women are still either just they're being prevented from finding them, or they're afraid of them. And I think generation will hopefully be the one to fix that and change it, and change the course of these women's lives.
but completely unaffordable without insurance. So there are some providers out there, the cash cow people I was talking about, who are charging thousands per year for treatment. Can you give an idea of, like, my regimen would be an estradiol patch and oral micronized progesterone. What roughly would that cost a patient?
So the patch is a little more expensive than the pill. I think we have a pretty competitive price. I think it's gosh, I should know this. I know the pill and the pill estrogen pill plus the estradiol pill plus the
Yeah.
progesterone pill is $40 a month. That's our most popular option, and that is the one of the more like the lower cost one. The patch I think might cost you something like $60 or $70 a month.
Mhm.
Um, we did get a pretty good deal on a generic patch. So we try to keep our prices really accessible. There's so many people whose HRT, et cetera, is not covered by their insurance. We have been around for a year. We wanted to make sure this was something people wanted, and now we're also exploring pathways to get reimbursed by insurance. But we certainly, are not trying to charge anyone any more than the cost of doing business. And we really also think that sort of 24/7 access to texting your doctor through your Alloy dashboard is a great service. So we think of it as, you're paying for the medication and the access to the expertise. So,
Mm-hmm. Yeah. And yeah, you're not paying for a doctor's visit. It's all included in the cost of your medication. So just so people know. Okay, everyone. This was so much fun, and thank you for joining.
I
Um,
really love getting to know you. I hope we can do this again sometime. And I'm looking forward to putting this up on our channels as well.
okay, great. All right. Take care.
Thanks so much.